fight off this disease or be in different areas that could, help them be away from people, or just different categories in which people can be affected by this. So the cities that I was assigned were Chicago, Illinois, El Paso, Texas, Norfolk, Virginia, and Oakland, California, and probably similar to everyone else's assignments. These cities are nowhere near each other. They're actually pretty spread. They're actually pretty distant from each other as far as looking at the U.S. map. So it was good to look at these maps, or look at these cities and see what similarities and differences they shared, and having vulnerability due to COVID-19. So my pre-ranking of the cities, at top, the first one I had that was most vulnerable was Chicago, Illinois, followed by Oakland, California, then El Paso, Texas, and lastly Norfolk, Virginia. I pretty much based these rankings off the population that I knew each city to have, not exactly, but have an idea of that population based off the popularity among the nations. And I know that Chicago is actually one of the biggest cities in the United States. So I figured having that many people in the city, it could pose a risk to people contracting the disease. And as far as Oakland, California, I know it's near San Francisco, California, which is a really big city as well. And I figured with it being so close to San Francisco that there might be a huge population in Oakland. And also the area of new cases rapidly growing that I've seen on the news. I see that California were hotspots. California was a big hotspot, and so I took that into consideration, put on Oakland at second. And then for as far as El Paso, Texas, and Norfolk, Virginia, um, I really just put those at the end just because I didn't have much knowledge about them. So that's the reason why they're at 3 and 4. So here's my first map. This map is displaying the population over 65 within the given U.S. cities. And as you can see, Chicago has the biggest population at 324,719 people. People over 65, and so I know with that, I know this was a great important variable to consider, because as people tend to age, their immune system grows weaker, in which potential diseases could affect them and possibly lead to death. And so I know looking at the statistics for people dying from this COVID or this disease, older people tend to have a more fatal or fatality rate. And so I just want to take that into consideration. And as you can see, followed by the next highest is El Paso with around 250,000, and then Norfolk and Oakland are a little less than that. So map 2, this is my map displaying the percentage of population in poverty within the U.S. El Paso has the highest percentage of people in poverty related to the proportion of people they have. I found that was interesting that they all have pretty close percentages in poverty. And the importance of poverty, or in this case, is that people who are underprivileged and have less access to resources they're already struggling, and so having a disease would not help their situation, being that it thrives, or it can be spread through social interactions in which people in homeless communities tend to be around each other more and are more likely to get sick. And so the access or the ability for them to get health care will be difficult, being that they don't have any financial funds to help them get better. And so that's just a big thing to look at when looking at the vulnerability of people. And within these U.S. cities, El Paso had the biggest rate, but Chicago had the most people or most total people in poverty, because as I said earlier, they're the biggest city and they have more of a population. But as far as race proportionally, El Paso topped the rest of the others at 20%, 20% of their population in poverty. Map 3, this is a map, also a United States map displaying the median household income And I took this as a I want to take this variable as a way it could be seen as positive or negative, being that if a household has more income, then it would greatly increase their chances of mitigating the risk or mitigating the vulnerability of being affected by the virus. But also, it could be negative if a family doesn't have as much or have a lower income uh, to get food and groceries and healthcare and other sources to help them out through through these tough times. And so, looking at this, Oakland had the highest median household income at $68,442. And I wasn't surprised by this, being that California, they have a higher standard of living, or anywhere out west or north, they have a higher standard of living uh, in regards to the economy throughout the U.S. economy or throughout the United States. So their cost of living is pretty high. So it didn't come to me as a surprise, but I just want to take this variable and look at it as a way to possibly help. It could possibly help or hurt people as far as looking at the vulnerability of them going through COVID-19. So that's that. Map 4. This map is displaying the COVID-19 risk index within the given U.S. cities. As you can see, Chicago has the highest COVID-19 risk index, and what the COVID-19 risk index is a combination of common medical conditions that are that typically are inhabit or that typically acquired through a lot of in a lot of Americans, which is diabetes, and hypertension, and high blood pressure, I believe. But it took a combination of those three medical conditions and basically come up with a score to determine the risk of people within that given city and see how many or how much people were in that city that were either had one of those medical conditions that could possibly affect them negatively and contracting the coronavirus, being that having one of those medical conditions tends to weaken the immune system, which is which can give the virus a gateway to come in and infiltrate their systems and sicken them and give them symptoms that we see today. And so that's with that. And as you can see, the next highest one was El Paso at a score of 2, and then Oakland and Norfolk with a score of 1. So um, they're relatively low because the COVID risk index scores go from 0 to 6. So um, that's one thing I found that was interesting. They weren't uh, they weren't as high as I thought they were going to be. So that was cool looking at that. Map 5 is displaying the percentage of population with asthma, and I just wanted to take this into account because I actually have asthma, so this was kind of personal to me. I want to see how it affected people around the world or around the U.S. And so Norfolk had the highest percentage of people with asthma at 10.5%, followed by Chicago, and then Oakland, and then El Paso. But with asthma, as I said earlier, this disease it travels through respiratory tracts, and so with asthma, that's a sort of like a respiratory disease that um, it can be hard to breathe at times when we're put in difficult situations, and so having asthma can be a downfall for people who are trying to it can be a downfall and contributing to the vulnerability of people acquiring COVID-19. So that was a big medical condition that I want to take into account because I actually have it. And looking at this, it doesn't seem like a majority of the population have it within these cities, being that they're at 10.5% and lower. So that's good to see. But there's still a presence of people with asthma that are still suffering. And so I just want to highlight that and see that information. So these were the results. The numbers are highlighted in red. Those are the highest for each of the different categories, and it's kind of just what I said on my maps. It's just these are the actual results of it. And it was actually cool to see that not one city dominated each category, which made that analysis interesting, seeing that different cities trumped others related to certain variables. And it just goes to show that each city is different and they have their own set of weaknesses that make them uniquely vulnerable. But as a whole, United States or cities in the United States would be more vulnerable than rural areas. And so this just I just want to highlight those differences and how each city was uniquely different from one another and being vulnerable to COVID-19. So after going through my maps and the information and the statistics, Chicago still stayed at top, which is I'm not surprised by that, um, being that they have a big population. And looking at the other variables that really drove this ranking was poverty, health disparities, and the proportional overall effects. And so with El Paso being moved to second, that was really based off their poverty rate because they had the highest one. And so I feel like that was important to um, place at the top of importance of cities being affected by it because they have a high, or people in poverty tend to be affected by it more, being that they're in struggling conditions. And then Norfolk, Virginia, that was mainly based off that was really driven by its number one ranking in the population with asthma, and also believe a third overall in population over 65. And just looking at that in the Oakland, we got moved to the back, which surprised me because, like I said earlier, it's close to San Francisco, and San Francisco has been heavily affected by it. And so it was just cool to see that. Cool to see that information kind of point me in a different direction and have facts to support it. But going into the proportional overall effects, that just really kept Chicago at the top, being that it has the highest population and the most amount of people being affected by it, or potentially the most of people that can be affected by it. And then as far as the other three cities, just looking at the rates that it affected the majority of their populations within their cities, kind of kept those, kind of put each of those cities in their respective spots from our post ranking. So solutions that I feel would be necessary to help mitigate these vulnerability would be servicing those deprived communities that suffer through racial health disparity or social status. And so that really goes into the people who are in poverty, and more specifically people that are in black communities, because I know that they have a lack of access to healthcare systems, and also it costs a lot to get those services. And so I would offer a solution to focus on those communities, but also aim to uplift them and not place such a barrier on them, or not place a financial barrier on them, or a social barrier on them, just because of the way they are, or the situation that they're in. Uh, I would say a use of the tax dollars to help fund those programs in which they can focus on those communities, so that they can also get the money they can to provide those services as well, but also just have a narrow focus on them, because those are people who are suffering the most. And then this is not a popular opinion, but implement and enforce the isolation policy. So basically, the stay-at-home order, being that I've seen some countries they actually gone down to a number of zero new cases, in which they had a strict stay-at-home order in which people were pretty much isolated in their homes, and the number of cases were decreasing. And so I would just suggest that uh, suggest to governors to implement the stay-at-home order a little longer until we can see a significant decrease in the number of cases, because just having people out there it could possibly lead to another spark, and we wouldn't want that. And so that would just be another way to mitigate the risk and the vulnerability of cities, is just have people stay home, being that this is a disease that can spread socially. Do we have any questions?
Okay, thank you very much. Does anyone have any questions for Russell before I weigh in?
No questions.
Anyone? Any questions? No? Okay. Just okay. Yeah, just have more of a comment than a question, I guess. If so, Russell, if you would, could you go back to your slide 12? Go, just bring slide 12 back up. Okay, and you can, well, I guess we can, yeah, just take it here from current slide, that's fine. Yeah, so I thought, yeah, this is a really effective slide because it clearly supports your logic. So if you notice, Chicago, in terms of population and percentage in poverty, all the cities are pretty close. Chicago being only a few percentage points lower than El Paso. Then, of course, when you're considering total population, that's a lot more people than El Paso or Norfolk, which is really shocking. If you just, wow, almost 20%, almost one out of every 5 people in Chicago in poverty, in a city that's probably got around, you know, a substantially large population. Well, 300,000 just in the city itself. It's much larger than the others, which again, Chicago, in terms of asthma percentage, I don't know how that percentage compares to the national rate, but still relative to the other cities, high. And then only mid-range in terms of median household income. I mean, that's, wow. I guess what we have to look at is in terms of geography, and I don't know what the geography is. I really would have expected for Chicago to have a significantly higher median household income than $55,198 per year. But considering that you have almost a fifth of the population in poverty, that could explain that drawdown. And so what you probably have in Chicago is a severe stratification of wealth, where you have some really, really wealthy people like Oprah, Michael Jordan at the top, and then a lot of really, really low income persons at the bottom. So yeah, I thought that this was a really effective slide, and it really answered the question that I was going to ask in terms of El Paso, because I was really surprised that El Paso has a relatively low risk score, given that it probably has a substantially high percentage of Latino population, but then their asthma rates are relatively low compared to other cities. That's very interesting with El Paso. That's something that we'd have to look into further, perhaps. I don't know. That's just interesting. So very, very, very well done.
Get this out the way. Okay, I got about 14 slides, so I'll get right into it. Good afternoon, everybody. My name is Adam Traore. I'm a senior agriculture science major with a concentration in biotechnology from Knoxville, Tennessee. And I will be presenting my presentation on COVID-19 vulnerabilities in the urban metropolitan areas within the United States. So the objectives of this PowerPoint, we're going to go through why it's important to go through the vulnerabilities, which cities will be analyzed, my initial vulnerability determinations, the most influential variables in my opinion. Then we're going to take a look at the map data and then the data for each city separately. And then I'll go through a summary of the data along with my final vulnerability determinations after analyzing all the data. And then I'll have some mitigation suggestions for vulnerable cities. So why it's important, determining the vulnerability of different cities within the country aid in determining where resources should be allocated and which areas are likely to need the most attention. Well, in this presentation, the cities that will be analyzed are St. Louis, Missouri, Tampa, Florida, San Francisco, California, and Baltimore, Maryland. So my initial vulnerability determinations, and these were basically hypothesized off of my bare knowledge of each of the cities. I really didn't, look into any facts about the cities. I was just going off of my personal knowledge of the cities. So when I determined the vulnerability, I basically was just thinking about population, because the way I saw it, more population, more people, more cases. And so that basically shaped all of this. And honestly, I would have put Tampa below Baltimore, but I really thought Tampa had a higher population than Baltimore, and I was wrong. I figured that out a little later on. But so yeah, so I put San Francisco at the top because, San Francisco, California, there's a lot of people in California. So I just figured, they're gonna have the most cases, and then Baltimore found its way to the bottom. And so these were the four most influential variables, in my opinion, from left to right, most influential to least influential. And as I said just a minute ago, initially I thought that the population was, the most influential variable out of all. But after looking at and analyzing the data, I came to the conclusion that poverty rates is the most influential variable for multiple reasons. The first being, people within poverty or areas in poverty, they have less resources generally. Not only do they have less resources, they have higher health risks. Maybe the people in that area aren't getting the nutrients they need. Maybe they're, eating below par food, the health problems. If you eat like fried chicken every day, you're gonna have diabetes, high blood pressure, things like that. And then not only that, most people in poverty probably don't have means of transportation, so they utilize public transportation, which is also a big impactor in the spread of this disease. The next most influential variable I thought was the percent of people without health insurance. And basically, if you don't have health insurance, you're probably not going to seek medical attention. Like if I didn't have health insurance and I was, maybe I had a fever, a cough, symptoms that were consistent with, COVID-19, I probably wouldn't, go to the hospital and risk getting that bill. I'd go to the Walgreens and just, get some cough medicine and some Tylenol, really, like. And so just doing that, you increase your chance of spreading the disease. And if you don't have it, by going out to get medication and stuff, you increase your chance of catching the disease. So there's that. And then the percent Black population. This was real influential to me because, as we all know, the Black population has been highly affected by this disease, distinguishably. And then not only that, there's, and that's both in, deaths and total cases. The Black population has been massively affected. And then not only that, the vulnerability in the Black population increases because there's many like health disparities within the Black population, high blood pressure, things of that nature, same as goes along with the poverty rates. And then just lack of resources in Black populated cities. We've discussed that many times in this class. And that's a real thing, lack of resources within these communities. And then still influential, but not the most influential in my opinion, is the total population. This does play a big part because more people does increase the chances of spreading the disease. However, the living situations of those people also has a much bigger effect. So then I put maps of those 4 variables. These were the 4 variables that I talked about the most, in my paper. And up here on the upper left, you have the percent in poverty. As you can see, St. Louis had the most people in poverty at about 22.7%. And then it was real close between Baltimore and Tampa as percent in poverty. And then if you can see over here in San Francisco, like they had about 4% of people in poverty. So it was, or I think it was 10%. I'm sorry, it's about 10% of people in poverty over here. So it wasn't that significant. And then you have the Black population. Baltimore had the highest Black population, followed closely by St. Louis, and then you had Tampa down here with the third highest. Oh, man. Tampa down here with the third highest, and then San Francisco with the smallest. And then now we have the percent of people without health insurance. That goes right back to St. Louis, leading of people without health insurance at about 19.2%, or about 20%. And then this actually surprised me once I was looking at this other data that Tampa actually has more people without health insurance than Baltimore, especially after I was looking at the poverty rates. But that's the data I found. And then San Francisco, again, dead last, and that's the 4.7% of people without health insurance. And then you have just total populations, which is really these three: San Francisco, St. Louis, and Baltimore. They all had, similar populations, but St. Louis did have the highest population at about almost 1 million people in the city. And then you had Tampa, they had only about 300,000, which is still a lot, but not in comparison to 900,000 people. So this is individual data for each of the cities, starting off with Tampa, Florida. Tampa, Florida had a total population of 392,890 people. Out of that population, 24.3% of those people were Black. And then they have a 19.5% poverty rate, which is pretty significant. And there's about 12.1% of those people going without health insurance. Next, Baltimore, Maryland. Baltimore, Maryland has 827,000 people, 827,370 people. 62.8% of those people are Black, and they have an 18.9% poverty rate, which is real close following behind, Tampa. And 6.2% of those people are without health insurance. Then you go to San Francisco, California. They have a high population, as I already knew, 881,549 people. Out of that population, only 5.6% of those people are Black, and only 10.1% of those people are in poverty. And then only 4.8% of those people are without health insurance. And then finally, St. Louis, Missouri, as I told you, they have nearly 1 million people, 998,954. And 45.9% of those people are Black, 22.8% are living in poverty, and almost 20%, or 19.3%, are without health insurance. So basically, to sum all this up, I made some graphs so that you guys could visually see, which cities and where they stand. And if you can note, St. Louis leads 3 of the 4 cities, all except percent of Black population in these variables, which, as I told you, are significant variables. So that'll have a real impact in my final determination of their variabilities. And then if you can also see San Francisco, which I initially had as the most vulnerable, they actually had the lowest numbers in everything except population. They had the lowest numbers of people without health insurance, the lowest Black population, the lowest number of people in poverty. So that brings me to my final vulnerability determination. And this is after analyzation of the statistics. So after looking at everything, I've determined that St. Louis was the most vulnerable, and that is because they have the highest population, the highest number of people without health insurance, and the highest number of people living in poverty. And then Baltimore, Maryland was close behind them. and vulnerability due to that high population. They have the highest Black population, and they also have relatively high, relatively high poverty rates and percent without health insurance. And in Tampa, Florida, the only reason I put that over San Francisco, even though they have a much lower population, was just because they led in everything. They led San Francisco and everything else. The poverty rates, the percent without health insurance, the Black population, they were above San Francisco. So in the end, I determined San Francisco was not the most vulnerable, but they're actually the least vulnerable. And so that brings me to some mitigation suggestions that I've came up with. As far as this will help with the poverty rates and people utilizing public transit. I think it would be good to have mandatory temperature checks. I'm not sure if in some areas this is already implemented, but if I'm about to get on the bus, maybe the bus driver should check my temperature before I get on. And then also wearing a mask is mandatory for utilization of public transportation. This would also help mitigate the spread exponentially. And then I feel like to aid people who may not have health insurance or, may be afraid of getting a bill from the hospital, no hospital bill if it's a visit for COVID-19 symptoms or suspected COVID-19 symptoms. And that could be implemented in multiple ways. How to make that work, that's a whole nother story, but that would be a good idea. And I don't know if it's been implemented in some areas or not, but just if I didn't have a fear of getting a fat hospital bill, I would be more likely to go get some medical attention that I need. So that brings me to the end. Are there any questions?
Yes, before we begin the questions, first, Adam, how do you pronounce your last name?
Sorry.
Well, I've been just destroying
Yeah, it's all good. I'm used to it.
And my last name that's French, right?
Yeah.
Yeah, my last name is French too. Anyway, sorry about that. So before we get into the questions, who would like to volunteer to go next so that person can get his or her presentation up while we do questions and we can just go right into it. So we try to save time. Anybody want to volunteer or be voluntold?
I'll go next, but I'm on my laptop. My desktop just stopped working, so I can't even pull up on my desktop. I mean, on my laptop.
Oh, did you sent your presentation?
Yes, sir. Yes, sir. I put it in the Dropbox. Yeah, sorry about that, Dr.
Okay, that's fine. That's fine. Does anyone have any questions for Adam?
I got a comment. I just want to say that I like the addition of the charts he had and giving us a visual.
Yes, that was going to be one of my comments. Yeah, that was an excellent. That chart on slide 12 was you could again clearly see the logic that once it's visualized, very easy to see how he came to this conclusion. He also made a really good point. His I guess variable of choice was health insurance, and that is a critical variable with regard to resilience and also, I guess, overall risk from a holistic standpoint. Oftentimes when we look at something like COVID-19, we focus upon the health impacts and which are obvious and which are serious, but then there are other impacts that are socioeconomic that can make a community significantly more vulnerable and could affect their ability to recover. Good point there. Second good point he made was with regard to public transit. And because some people, especially a lot of the essential workers, including the people who drive the buses, are probably considered essential. That's how a lot of the folks who are now essential, the janitors and the custodians and the cleaning service people that we absolutely need right now, that's how they probably get to work, because those are very, very low paying jobs. And so we have to keep them safe. But if they're and it's very difficult to social distance on a bus or in a subway. So very, very good points there. So thank you, Mr. Trere. I probably messed it up again.
Yeah,
Yes.
Okay, it's moving and everything.
Yes, you're
Okay, boom. COVID-19 city vulnerability, and my name is Jacob Rawls. Alrighty. So first topic we're gonna go over is an overview of the COVID-19 pandemic and its impacts. The second topic will be the ranking of the cities with the reasoning before evaluation of the variables. The third topic will be variables most important for city rankings. The ones I think, the fourth would be the slides 6 through 11, which is the fourth topic, will be GIS variable maps of cities with descriptions. Slide 12, which is the fifth topic, will be the new rankings for my city based on the information gathered. Sixth topic was slide 13, possible mitigation solutions to minimize COVID-19 cases. And the last one is my works cited. So overview of the COVID-19 pandemic. So the COVID-19 is arguably the worst widespread virus we have seen in history. COVID-19, or the coronavirus, is a respiratory infection that causes difficulty breathing, chest pain, and loss of speech and movement. Individuals that are at high risk for developing serious complications from the disease are the elderly and people with pre-existing conditions. And examples of those will be asthma and cancer, or like COPD, just any respiratory infection. The disease is spread through physical contact with infected individuals and surfaces. This includes being coughed or sneezed on. The United States alone has 1,602,446 cases, with about 95,021 of those cases being fatal. These numbers continue to grow with each passing day. And I found a site that like updates the case number every so often, like every hour or two. So that number is probably gone up. So city rankings. For this assignment, I was given four different cities and told to analyze their vulnerability to the COVID-19 virus. Before I did my research, I thought it would be appropriate to rank them first. This ranking is solely based on their populations. I thought that larger populations would be at higher risk for more cases. So the first one I have is Boise, Idaho, which is the most vulnerable because it has the largest population. The second would be Little Rock, Arkansas. The third would be Flagstaff, Arizona. And the fourth, and the lowest population would be Dover, Delaware. So although we were given, so these are the most important variables. So although we were given many different variables to analyze, I feel as though the most important variables to observe when determining a city's vulnerability are as follows. So population density, which is how close people live per square mile. Percent of population over 65. This group has one of the highest amounts of individuals with pre-existing conditions. Percent of African Americans and minorities typically live in low-income neighborhoods, with limited access to healthcare. The fourth one is percent of population with asthma, and this is a pre-existing condition that affects the respiratory system. The fifth variable is the percent of the impoverished population. These individuals have little to no resources at all and often live in very close proximity with each other. The sixth one is air quality, which affects almost all pre-existing respiratory illnesses like asthma and COPD. And then I have an honorable mention, which would be unemployment percentage. All right, sorry for the map kind of looking weird. It just, I don't know, the quality wasn't good. But figure 1 shows the population density. So this figure reflects the population density of four cities. Flagstaff, Arizona has a population density of 1,148 persons per square mile. Little Rock has a density of 1,576 persons per square mile. Dover, Delaware's population density is 1,656 persons per square mile, and Boise, Idaho has a population density of 2,592 persons per square mile. And Boise is the highest, and Flagstaff will be the lowest. Next figure I have is the percent over 65. So this figure shows the percentages of the population in my 4 cities over 65. Little Rock has a 13.7% of their population over 65. Flagstaff has a 8.3% of population over 65. 13.6% of Boise's population is over 65. And Dover, Delaware has about 13.9% of their population over 65. Next figure I have is the percent of African Americans in the population. So this figure represents the percentage of African Americans in the 4 cities. The percentage of Black people in Little Rock is 14.1, so pretty much almost half. In Flagstaff, the percentage is 2.3. And in Boise, Idaho, the percentage is almost 2.1. So in those cities, there are little to no African Americans in those cities. In Dover, Delaware, so that's not right. But Dover, Delaware is 45.5. I didn't mean to put that. So almost half of their population is African Americans as well. The next figure I have is the percent of population with asthma. So figure 4 shows the percentage of adults that have asthma, which is a respiratory condition. 1.9% of adults in Little Rock have asthma. 10.5 and above percent of adults in Flagstaff have asthma. 9.6% of adults in Boise have asthma. And Dover, Delaware has a 10.5% of adults in their population that have asthma. The next figure I have is the percent of the impoverished population. So figure 5 shows the percentage of individuals that live in impoverished conditions. 17.4% of people in Little Rock live in poverty. 19.7% of adults in Flagstaff live in poverty. 13.5% of people in Boise live in poverty. And Dover has the highest, which is 22% of people in their population that live in poverty or in impoverished conditions. The last figure I have is figure 6, which is air quality. And this was one of the variables that I chose. So air pollution in both cities and rural areas were estimated to cause 4.2 million premature deaths worldwide per year in 2016. This mortality is due to the exposure to small particulate matter of 2.5 microns or less in diameter, which is PM 2.5, which causes cardiovascular and respiratory disease and cancers. So yeah, Dover has the highest, which is 14.06 micrograms per I forgot what that stands for. Yeah, but as you can see, Dover has the most, the worst air quality, I would say. Next. So my new city rankings, after examining all the variables listed, the rankings that I have that I had in my cities the first time was correct. Based on all the data that was collected, Dover, Delaware was the city that showed the most vulnerability to the COVID-19 virus. This is because the community had a high population density, a high percentage of elderly and asthma-plagued individuals, a high percentage of minorities in the population, and a very bad air quality. So mitigation techniques to minimize COVID-19 cases and death. So you can practice all social distancing techniques provided from the government. Examples of these would be wearing gloves, masks, hand washing and sanitizer, and the 6 feet rule. Do not leave your house unless needed. Also, you can self-quarantine yourself if you start noticing signs of illness. Of those 1,602,446 confirmed cases in the United States, 371,795 of those individuals successfully recovered. Also, it is important that the government provides the proper healthcare resources to underserved communities. These are the areas that the impacts of COVID-19 are felt the worst. And those are my works cited. That's it.
Okay, thank you, Jacob. So before we go into Q&A, does who wants to go next and can get to their get his or her presentation up pretty quickly? You don't have to.
Next.
Rawls, you can keep sharing.
Do I need to keep sharing?
Yes, definitely. Yeah, for
I
the
bet.
Q&A. Who is going next? I heard.
I can go next.
Okay, so we'll just but don't try to share. Just get your PowerPoint presentation ready, just so we can have a smooth flow. Yeah. So again, very good presentation. And this is a question for anybody. I know that I didn't require you all to do multi-variable overlay in your maps.
I tried to I compared all my variables to the population. I tried. It was hard.
That's fine. This is not a GIS class. I mean, well, it kind of is, but but anybody, what two variables would have been really interesting for Rawls to create a two variable overlay with? Which two of his variables, if you can remember which ones they were? There were two
I
that
can bring it back.
really
I can bring it back up.
really interesting overlay.
Here you go.
Anybody? There's two of them that would have made a really interesting overlay.
The percentage of African American.
Yeah, well, I wasn't thinking about that, but there's two of them that would have been a really interesting overlay because they're very closely related to one another.
Air quality and the percentage of population with asthma.
Exactly, air quality and asthma. That would have been a really interesting overlay to see, and that's a lot of the discussion that's happening now in terms of aligning or seeing that there is a correlation between PM 2.5 or poor air quality and COVID-19 hotspots. But the question is, do those environmental conditions result in poor, or not poor, but in exacerbated suffering from asthma? And then further, of course, knowing that African Americans have asthma at a greater rate, there is a way to play with the symbology. Like I said, once you get to three variables, but then African American population, asthma, and poor air quality, the symbology would be, symbology would be tricky. The map symbols would be tricky to make that easily readable. But yeah, those would be great. Okay, so thank you very much, Rawls. I think that was, I'll give you other comments, but I won't go into those right now. Let's see. Was that Rebecca said you were gonna go next?
So do you know?
Okay, so my name is Rebecca Wynn. I will be presenting my COVID-19 vulnerability for my 4 cities. So the cities that I was analyzing are Phoenix, Arizona, Cleveland, Ohio, St. Petersburg, Florida, and Oklahoma City, Oklahoma. The most influential variables that I took a look at, what I made my hypothesis based off of, was the population, which tells us how many people are susceptible to spreading the virus. Like many of our other peers have presented, I thought that more people meant that more people could spread the virus. Then I also looked at the population density, which is, how many people are surrounded by each other, how many people are close, the proximity of the people and the others around them. I thought that that was very important. And then I looked at the obesity rates. The level of health of people should be linked to these rates. And the vulnerability that each state has, each city has. Last thing that I looked at was the poverty rate. And I took this because it shows how cities handle wage gaps and opportunities for people. And this is directly related to the infrastructure in the city and how they, combat different things that can go on or negatively impact the city, like the coronavirus. Giving a visual to each of these variables, this map shows the populations from each city, and the markers are in proportion with the population. This lets us, see which one has a smaller or a larger population. Phoenix, Arizona has the largest population out of all of them, of 1,660,272 people. The second largest population was 1,300,000 people, which was in Oklahoma City, Oklahoma. I did not know that. The third largest was Cleveland, Ohio, which was 1 million people, and the smallest was St. Petersburg. I did not know that either. The second factor was the population versus the population density, which was the second thing that I considered. The largest was going to be Cleveland, Ohio, with 5,107 people. The second largest was St. Petersburg. Though they have one of the smallest populations, they have the second largest population density. The third is Phoenix, Arizona, and the last is Oklahoma City, Oklahoma. Taking a look at obese adults in comparison to like the entire population, that's what this third map shows. Phoenix, Arizona has a moderate obesity rate of 28.5%. St. Petersburg has a rate of 27.7%. Oklahoma City had the largest rate of 40.6%. That's nearly half their population. And Cleveland, Ohio has 35%. I chose to look at this comparison because it shows how healthy the people are. I figured that would contribute to the spread of the virus. How people combat things. Obesity and food deserts are related, and that shows the impoverished community as well. So based off of this, my prediction was that the highest vulnerability would go to Phoenix, Arizona. The next highest would be St. Petersburg in Florida. The second to last would be Cleveland, Ohio, and the lowest was going to belong to Oklahoma City, Oklahoma. Was my hypothesis correct? The final rankings were different than the expected rankings in the hypothesis. 2 were correct and 2 were not. Looking at racial health disparities based off of what I found, it was found that there were racial disparities in both Phoenix, Arizona, and Cleveland, Ohio. This is seen where the percentage of Black people was significantly disproportionate to the population. Cleveland, Ohio's Black population comprises 49.6% of the total population, and that's really nearly half of their population. And Phoenix, Arizona has a population of only 6.9% of their total population, despite having one of the largest populations out of all 4 cities. Giving a visual of this disparity, you can see that the largest differences are found in Phoenix and Cleveland. So the final results, the risk indexes, Phoenix, Arizona had the highest, which was 2, St. Petersburg of 4, Oklahoma City of 0.36, and Cleveland, Ohio of 0.37. So the one map that you gave us sort of shows this risk analysis. And though the points that I had are not showing, Phoenix's risk is the highest. Cleveland's risk is moderately high. And if you look down in Florida, St. Petersburg risk is on the lower side of the scale, but still in the middle. And Oklahoma City's risk is moderate. It was also found that population was not the largest contributor to being, for a city to be vulnerable to the virus, which I thought would have been the case. And poverty rates were most significant in determining the vulnerability. This speaks volumes about the impacts of low-income treatment in healthcare. which was more so my take on the link between obesity and being vulnerable. What this map does is provide a visual of that. If you look at the COVID risk index and the colors that are on the map, the colors of the small dots in each city, not the larger ones. We see that Phoenix, Arizona does have the highest risk index, and then followed by Cleveland, Ohio, Oklahoma City, and St. Petersburg. Looking forward in the future, there must be some form of relief for poor people. Demographics of low income are most vulnerable in every aspect. Wealth creates more resources, and some form of infrastructure needs to be in place for those without resources and means to obtain them. And this was the map referenced for the risk analysis map. Are there any questions?
Okay. Yeah. Wow. That was. Oh, someone has a question? Okay. Wow. That was really something else. So I mean something else in a good way. Man. Yeah. So could you go back, Rebecca, to the slide where you had keep going, keep going, keep going. Not that one. Keep going. Keep. This. Oh yeah. Move. Yeah, this risk index. Is that your own index? That you kind of.
No. This was from the policy map that you gave us.
Oh, okay. Oh, policy map risk index. Okay. Okay. That. Well, yeah. I was like, where did that come? Okay. Yeah. Okay. So, and so then you're saying move forward to the you. And so that map, so I can't see, it looks like Phoenix, looks like, yeah, you said Phoenix is high. And then go to the next slide. The next slide after that. Okay, then we have this map. Okay, that's an interesting map, but clearly, again, given the symbology, Phoenix. So the color ramp, okay, I see.
The color matches the obese adults, but the sizes go with the population.
Yeah, population. Yeah, this is three variables on one slide. But yeah, I can see by that array that Phoenix falls into that COVID-19 risk area. So that jives with everything else. So Phoenix was your top most vulnerable.
Yes.
Okay, so that is very creative approach there. Lots of yeah, I like that. I mean, Rebecca took some risks, but I mean that's good. Sometimes you have to take some risks in order to push the envelope on in investigating. And yeah, not perfect, of course, but it's good to see a student that wasn't afraid to push the envelope a bit. It's not perfect, but it's really I'm going to definitely go back and look at this PowerPoint later. That was a good one. Okay, so thank you very much, Rebecca. So who's next up?
All right, so my name is Zara Hauser. I'm a rising senior majoring in sociology, and here's my presentation on urban population vulnerability to coronavirus. So today we're going to be talking about the purpose of this project. What is COVID-19? The cities affected, and the cities of my analyzing the maps and my results and my finding rankings and the solutions. So the purpose of this project is to see what cities are the most vulnerable to COVID-19, also to study how it affects, also to study how it affects these populations. So I'm going to talk about COVID-19 a little bit before I head into the project as a whole. So COVID-19 coronavirus is actually a large family of viruses that are zoonotic. And zoonotic just means they're transmitted from animals to humans. there has been previous, coronavirus is just a virus that attacks the respiratory system, and there's been multiple coronavirus outbreaks in the past. In 2002, there was SARS, and then in 2012, we also had MERS, which is the Middle Eastern Respiratory Syndrome. So there's been different versions of coronavirus that we've seen in the past. This one's just been very big in its outbreak, and it's been much of a harsher attack on the human body and the immune system. So the infections spread by coughing or sneezing. So that is something that was that made this virus very difficult to deal with, because it could just be transmitted at a very fast pace. So the cities that I analyzed were San Antonio, Texas, Indianapolis, Indiana, Birmingham, Alabama, and Omaha, Nebraska. This is my original ranking before I did any research. I made this based off of prior knowledge of what I thought the cities would look like based on population. So some influential variables I looked at were the population of Black people in the cities, poverty levels, and also adults with asthma, since people are more susceptible to coronavirus based on pre-existing conditions like asthma, or if you're elderly over the age of 65. So these are my maps. So my first map is looking more so at the population of the cities. So San Antonio actually has a population of around 1,329,000 and some change, and some other more. Indianapolis has a population around 800,000. Birmingham has a population around 200,000, and then Omaha, Nebraska has a population roughly around 400,000. So that was interesting to me. I didn't know San Antonio. I knew San Antonio had a big population, but I didn't know it was like 1 million. So that was really interesting. Then I also decided to look at the Black population. I wanted to overlay some of the variables, but it was kind of difficult to navigate that and make them visible on the screen. So I just decided to do single variables. So the Black population in Omaha, Nebraska, Indianapolis, and Birmingham. I didn't know Birmingham I knew it had a huge Black population, but I didn't know it was huge to the extent that it was. 70% Black people in Birmingham, which was very interesting to me, coming from little old Cincinnati, Ohio. So that was very interesting to see. I also looked at poverty level. Poverty level is important because a lot of people will be affected by the coronavirus, being laid off and being laid off from work or not being able to work. They won't be able to have that sort of income support that they did. So looking at the basis of the poverty level for the city before the virus even happened, we get to see this kind of this idea of how much people can get access to resources such as testing, because not all the time that testing is free for the virus, or also just accessing things that as simple as like soap or food resources and things like that. I also looked at adults with asthma, since asthma is one of the pre-existing conditions for you being more susceptible to coronavirus. So looking at that was important as well. My final rankings that I came to were San Antonio, Texas being at the top because of its population, as well as its population over 65 was very huge. I think it was around 18%, I believe. And then Birmingham as well being top because of its poverty level, as well as its Black population being around 70%. Then Indianapolis because of its poverty level as well. And then Omaha, Nebraska least, because it's not strange, it's just their vulnerability is not as high as what I've come to research and follow. I feel like I'm going too fast. If you guys need me to slow down, I can.
You're fine.
Okay, so these are the results I have. So we have the cities being listed here, but I also have a graph of like the population, the poverty level, Black population, the population of adults with asthma, and the population over 65. So in San Antonio, as I said, has a population of 1 million, but its poverty levels are also 18.6%. And then we have Birmingham, whose population is 209, but their poverty population is 27% of the population is in poverty, or at the poverty line or below the poverty line. Indianapolis, and then Omaha, which has a significant amount of, all these cities have significant amounts of poverty levels. So along that with the results, I said San Antonio and Birmingham are the cities most vulnerable to coronavirus, and Omaha being the least. Some solutions I think we should follow with the ongoing pandemic is that we should continue to have social distancing. People should continue to wear masks, stay 6 feet apart in distance when they're in public places. I think there should be more testing. And I also think we should start educating people more about the virus. And so, you know, handing out information instead, because there's like a lot of rumors, as we talked about before, it's like Black people not being susceptible to coronavirus, even though they're the most, we know now that they are the most likely to have it and not be able to get treatment. I think it's important that we educate the masses about it. And that's my work side, and that's it.
Okay, so that was Hauser. Yeah, could you go back to let's see, just very quickly go back to your let's see, just let's see, where's your final ranking slide?
Final rankings, here we go.
Okay, so you had San Antonio was first, Birmingham was second. Go to the next slide. Oh man, so I mean, I'm just eyeballing this, and just eyeballing it. It appears just from my eyeballing, it would appear to me just that Birmingham, you know, taking away, you know, did Birmingham not garner your top spot because of the low population? Because the other variables, to me, put it at the top in terms of risk, relative risk. I mean, you've got the greatest percentage of population over 65. Adults with asthma is in the top 2. Black population, 70%. Significantly higher poverty rate. But I mean, so what was it what was your rationale for that? Putting San Antonio above Birmingham?
I think it was initially the population. And when I talked in my paper, I talked about overlooking some data. And I think that I was overlooking mostly the population of Birmingham, since it is such a small population and it does have other things that can affect it with it having that such small population, it is more vulnerable. So I think I kind of overlooked that and was just looking at like the bigger number of, oh, like San Antonio has a bigger population. So I think that's somewhere where my data probably tells more of the truth than not the truth, but more of the factual information than what I was processing. So I think that was something that I overlooked.
Yeah, it will be interesting if you know, before you turn in your final paper, I don't know, if you looked at some of the COVID risk variables and see where San Antonio and Birmingham wound up. I mean, you could be correct. I don't know. But this meaning what I'm talking about is one of the issues in terms of developing risk-related indexes or any kind of index is that the raw data that go into making that index aren't going to be uniform. I mean, everybody that creates an index is going to use a different set of variables and you're going to get different results. And who's right, who's wrong, who knows, right? But I'll be curious to see where San Antonio and Birmingham fall either on some of those COVID-19 risk index maps that we look at, and even where they fall in terms of rates of infection. Just something that that was just curious. I mean, you could be right. I don't know. I just asked the question. I just wanted to see what your rationale, because like I said, on face, it looks like Birmingham, in terms of the relative risk to San Antonio, regardless of the population, would be at higher risk, but who knows? Also, anyone, given what we know about San Antonio, is there another variable that we might toss in there in terms of population? I'll just narrow it down to save time. what other demographic data might we look at for San Antonio?
The Hispanic population.
Yeah, exactly. Hispanic, like Latino Hispanic population, exactly. So thank you very much. That was also very well done. Who is our next volunteer?
I'm going to present. I've been able to. Hello, everybody. My name is Theodora Efiasawa, and today I'll be presenting on urban population vulnerability on COVID-19 pandemic. So this is my table of contents. I'll be introducing you to the topic of COVID-19, the vulnerability that it brings on urban cities. And I'll be using four cities as a case study. And also I'll be presenting data variables for analysis. I will also show the initial and final vulnerability risk rankings and explain the results alongside with the some solutions. And if you have any questions, you can ask me after that. So the world right now is facing a very big problem, that's COVID-19. And in order to analyze the risks that it poses on urban cities, I'll be using 4 cities: Albany, Georgia; Portland, Oregon; Albuquerque, New Mexico; and Providence, Rhode Island, to show how vulnerable cities may be with regards to certain variables. I'll be using GIS maps together with the variables to study this disease outbreak. So this is just some information that I gathered from the cities. The variables that are very important for this study will be population, the population density, the population of people over 65, the percentage of people who are poor in these cities, and the percentage of people who are Black in these cities, adults with asthma, and people below the age of 65 who have disabilities. That was the special variable that I chose for this study. This is also is basically what I said for the slide above. So this slide has to do with the population and the population densities associated with the cities. Over here, we see that Portland, Oregon has the highest population, and also Portland, Oregon has the highest population density. And the least populated city here is Albany. It also has the least population density. Albuquerque and Providence have a relatively high population with regards to the information I have. They have a relatively high population, and population density for Albuquerque is relatively higher than the population density for Providence. So I did a multivariable analysis in this map, we see percent of the people who are Black, and then the percent of the population who are over 65. This pandemic is really affecting these people. So I thought it wise to put these two variables together and study how they relate to each other with regards to these 4 cities. We see here in Albany that they have a very high Black population, a Black percentage of about 73%. And they also have a low population below 65. For the other 3 states, that is Providence, for other 3 cities, that is Providence, Albuquerque, and Portland, they have similar demographics when it comes to percentage of Black and population over 75. They have a high population over 65 and a low percentage of people who are Black. For this second map, I also put together poverty in relation to population density, because poverty is when people are poor, they lack a lot of health amenities or health things that will help them mitigate the risks. So I thought it wise to put poverty and population density because it's shown that people who are clustered together have a higher risk of spreading the disease, that is COVID-19. They have a higher risk of spreading the disease. So putting these together, I realized that Albany, Georgia has a very high poverty rate, but has a low population density. And also, Providence, on the other hand, has both low poverty, both low poverty rate and a very low population density as well. Portland, Oregon was opposite for Albany. They have a high population density and a low percent poverty. And then Albuquerque, on the other hand, also has high. It has a moderately high population density and a moderately low percent poverty. So I also put percent of people who are under 65 who have disabilities together with social vulnerability index. I did that because we know that these people may have underlying health conditions that increases the risk at which they may contract the coronavirus disease. So I put it together with the social vulnerability index, and we see here that Albany, Georgia has both high social vulnerability index and a high percentage of people who have disabilities. Portland, Oregon, and Albuquerque also have similar demographics. They have a high percentage, they have a high social vulnerability index with low percent of people who have disabilities. And Providence has the opposite for both Albuquerque and Portland. They have percent of a higher percent of people who have disabilities and a low social vulnerability index. I also put together people with asthma, a percent of adults who have asthma and social vulnerability index. I chose this variable because the COVID-19, as I said earlier on, affects a lot of people with respiratory and cardiovascular diseases. So I wanted to analyze how this will also play out. And we saw here that even though Albany has a high social vulnerability index, they have a low percent of people, of adults with asthma. And Oregon, on the other hand, Portland, Oregon has a both high social vulnerability index and higher percentage of people who have asthma. And then Albuquerque, on the other hand, has a moderately high vulnerability index and a moderately low percent of people who have asthma. But Providence has a very high percentage of people who have asthma and a low social vulnerability index. I just put these two indexes together to also see how they play out. We see here that Albany has a high social vulnerability index and a moderately high COVID-19 vulnerability index, whereas the other states have a low COVID-19 risk index. And then, Providence has a high COVID-19 risk index and a low social vulnerability index. I also looked at this Javoin COVID-19 index, and it shows that Albany, Georgia has a medium index or medium risk. Providence and Albuquerque have a very low risk index, and Portland has a low risk index. So, judging from my analysis, initially, I kind of got the rankings right. Ranking Albany as the first, Portland as second, Albuquerque as the third, and Providence for the last position in regards to most to least vulnerability. But after analyzing everything, I realized that Providence and Albuquerque, Providence has a higher risk than Albuquerque, or vulnerability risk than Albuquerque does. So from my results, the results show that all the variables for the level of vulnerability in each city was unique. No city highly dominated in all the variables used in studying vulnerability. However, assessing these 4 cities, I realized that Albany has the highest vulnerability index for COVID-19. And the leading factors being that Albany is predominantly African American, and I read from the CDC that it's really affecting African Americans, and also it exhibits the highest level of poverty amongst these 4 cities. So the solution to the problem is that all the cities must be equally well equipped with the healthcare supplies needed to fight this disease outbreak, with emphasis on communities suffering from poverty. I say that they should be equally equipped because the way the disease spreads, it doesn't know class, it doesn't know race. If, for instance, one person, if it decides to spread, it will affect everybody, but the emphasis should be on places with poverty because it has a higher risk of spreading. And that lockdown policies must be put in place to prevent the spread. Also, masks, shields, preventive, protective gear should be, and testing kits should be provided to the residents of countries around and in the United States. Also, social distancing should be practiced, such as no handshaking, no hugging, maintaining the 6 feet rule, and staying at home if you don't have anywhere to go to. And also, I believe that residents in the United States without an insurance policy should still be granted access to all the necessary healthcare facilities in order to help stop the spread of COVID-19. Also, one interesting fact that I didn't put here was that even though Albany has it's a very small city with a very low population, but it still has the highest vulnerability, because I think that if it decides to spread amongst the whole population, it will really have an impact on them because they are a small population. It can easily not wipe them out, but it can, when it decides to hit, it can hit them really hard and cause a lot of effects. Thank you very much, and your questions are welcome.
Okay, before I ask, does anyone have a question for Theodora? I guess it's not. Yeah, so very well done again. Actually, you, Theodora, you pretty much answered the question I was going to ask, because you went against the grain of all the prior presenters in that, everybody that presented earlier seemed to place emphasis upon population size, whereas clearly you looked more at, I guess, relative risk for infection or who knows what else, negative results as a result of exposure to the coronavirus, which is interesting in this entire journey we're on with this disease. So, for example, it's all how you look at it in relative terms, which makes it difficult sometimes for us to devise a rational mitigation response. So I noticed that Theodora said, someone else was like, yeah, we should be locked down and all this and that. But I don't know about you, but I've been out. And I've been in places in Nashville where I'm the only person that has on a mask. People looking at me like, why do you have the mask on? I watched a webinar on the social behavior amongst people in the context of coronavirus. And African Americans, unfortunately, were determined by this particular study to be, the least people involved in social distancing. We're the least compliant in terms of wearing masks, but yet we're dying at incredibly high rate. But there could be all kinds of explanations for that. And I've even heard anecdotally people say, well, just being Black in America is dangerous. Coronavirus is just one more thing. Like we might get shot by the police. We're in poverty. I don't have a job. Yeah, we got all these other threats. But if you look at it in terms of population, if you look at it in a relative sense, okay, so I think we are at maybe about 300,000 deaths globally, right? 300 and some, maybe I'm wrong, might be four, even if it's 400,000, I don't know. But about 660,000 people just in this country die from heart disease every year. Another 600 and some thousand, not globally, just in this country, die from cancer. And that's just in this country. So more people die of other things than that have died so far from coronavirus on the entire planet. And then when you look at, I was looking at the Tennessee data yesterday. So in Tennessee, there have been about 300,000 people tested, right? Out of those 300,000 or so, or close to it, maybe about 20,000 have tested positive, right? So, and we're testing people who are either at risk or are symptomatic. So, and then out of that 20,000 or so that test positive, maybe 2,000 are actually hospitalized. And then maybe out of that, maybe 300 people have actually died, right? So when you look at those numbers in terms of relative risk, so risk is the possibility that a hazard will occur. Maybe people are ostensibly saying, look, I could get struck by lightning. You know, I mean, that could happen to me too. And I'm not a health professional. I have my own theories, which is I think coronavirus has been around for longer than we think. And people have been dying of pneumonia and other natural causes. We just didn't know it was coronavirus. But that's completely unprofessional, unsubstantiated opinion.
Do you know on the back of like the Clorox wipes and Lysol wipes, they have like, it says they fight coronavirus?
Already?
You know that? Yeah, no, I think it had been on there, but I don't think nobody really paid attention because they claim it's a different strain.
Yeah, the common cold is a coronavirus, as is so it's like, so that's the virus family. So yeah, the common cold is a coronavirus. So yes, exactly. But this COVID, exactly, is a much more potent and obviously deadly strain of what we would call the common cold. And so there's that. Also, in terms of risk, and I completely lost my train of thought. So let's move on to the next. I'll think of it later. But let's move on. I think unless anybody else has any other comments. Pause the recording back and share screen. And oh, come on. Come on now. Okay, Lauren, just tell me when to advance the slides.
Okay, all right. Sorry, y'all. Excuse the background noise. I'm outside and it's raining. Okay, so I am Lauren Carruthers, and this is my coronavirus COVID-19 city vulnerability RGIS mapping study. You can switch to the table of contents. Okay, so this is just my table of contents page, just giving you a breakdown of everything we'll be talking about, like the impacts, the cities that I researched, as well as my maps and the results of those maps, as well as solutions, and then where I got my information from. You can go ahead and switch for me, please. Okay, so the coronavirus pandemic is claimed to be nothing like any healthcare professionals have seen before. So I'm sorry, y'all. Oh my God. Okay, I'm sorry. But basically, you know, COVID-19 is said to be nothing like anyone has ever seen before. So the purpose of this study was to assess different variables that could potentially contribute to the spreading of the virus, and also identifying the most vulnerable populations. Next one, please. So here are my 4 cities that I researched, as well as them being ranked in order from the most to least vulnerable. So the most vulnerable I had as Austin, Texas. Number 2 coming in at Nashville, Tennessee. Number 3, Columbus, Ohio. And number 4, Richmond, Virginia. Can you switch for me, please? Okay, so my first map just compares the population density in comparison to the population. So as you will see, the orange dots represents, you know, the population of the city. And as you can see, you can't really see Richmond's because their population is so small. And then the color dots represent their densities in particular numbers. So the lowest population density was in Nashville, had about 1,265 people per square mile. The next one was Austin, Texas, which had 2,600 and about 53 people per square mile. Richmond, Virginia has about 3,414 people per square mile. And Columbus has about 3,624 people per square mile, which is something interesting to really key in on and look at, because you can't really, they have the smallest population in comparison to all the other cities, and they're the second highest population density. Next, please. So my second figure represents the percentage of the population that are over 65 in comparison to the population. So you see in Austin, Texas, which is down here at the bottom, they have a very small percentage of individuals over 65. As we move up Nashville, it's kind of about the same, kind of in the same perimeter of their population, which represents that they have a fairly decent amount of people over age 65. But as we come over to look at Richmond, you see that they have a great population over 65 in comparison to their population, which is very, very small. I think they're coming in at about 13.2%, somewhere in there. And then Columbus, Ohio, they have a fairly moderate population of individuals over 65, coming in at about 10% or so. But this is where we kind of really get into like the racial disparity and demographic potential risk of the coronavirus, especially since they said Black people are the most prone group to catch the virus. So Richmond, Virginia, I hope y'all can see. Can you switch, please? Sorry, I got to tell you that. So Austin, Texas has a very, very small population of Black people in their city, ranging, coming in at about, let me see, very small population, coming in at about only 8%. And then we move up to Nashville, fairly moderate. About 27.9% of Black people are Black in Nashville. And Cincinnati, sorry, not Cincinnati, Columbus, about 25.8% of Black people make up the population. But once we get to Richmond, we see that they have a lot of Black people. Almost half of their population is Black, coming in at about 47.8%. Can you go to the next slide, please? Okay, so this shows the poverty within the city, which is, you can make a strong comparison between the percentage of the Black people and those in poverty. So as you can see, Richmond has the most poverty out of all of the 4 cities, accounting for 22% of the population that are faced with poverty. And the next in line is Columbus, Ohio. It has about 20% of individuals in poverty. And Nashville also has about 16.5% of their population in poverty. And Austin, Texas has a very small percentage of their population in poverty, only about 14%. And in this one, you can kind of compare it to how they're coming in last in a lot of these demographics as far as the percent over 65 and the percentage of Black people within a population, which kind of makes you assume like it's because the racial demographics and age that's bringing the poverty rate of the cities down, which could also contribute to the influx of the coronavirus. Okay, you can go to the next one, please. So this map is a representation of those within the 4 cities battling asthma. Nashville has kind of ranked kind of mid amongst the 4 cities and the other variables. However, they are kind of taking over in this one, which could kind of be contributed to the influx of people moving in the city, construction, yada, yada, all that. So about 10.3% of adults in Nashville have asthma. And then Columbus is coming right behind them at 9.6%. And Richmond is right after that at 9.4%. But again, we see Austin, very small percentage, ranking these variables at about 7.8% of adults with asthma. Can you go to the next one, please? So this map is representative of the city's measures to fight things like this. Like how can they overcome it? Like, and things of that nature. So Nashville is ranked number 1 again. So they're coming up in the charts as having a 54.5% social vulnerability index. And Richmond is behind them, coming in at 31.4%. But then the lowers start to dwindle when we get to Columbus, Ohio, which has a 10.66%. And Austin, Texas, which is 2.38, which is kind of shocking, which kind of put a twist in my final rankings because they were scoring high everywhere else, but they're a socially vulnerable population. Next slide, please. Okay, this map is representative of the homeless population in each of the 4 cities. So as you can see, Richmond is very, very small, although they have higher poverty rates and higher percentages of Black people. They have the least amount of homeless people within the 4 cities. And Austin was also kind of shocking too, because they were ranking low in everything else in comparison to the other variables, but they still have a decent size of homeless population, especially in comparison to Nashville, where we do have a lot of homeless people residing here. Can you go to the next one, please? So this is my last map, which is basically identifying the COVID-19 risk index of each of the 4 cities. Austin, Texas, and Columbus, Ohio have the lowest rankings. And then about Nashville and Richmond, they're kind of in the same areas. Okay, you can go to the next one. Okay, so my preliminary rankings prior to my research, I found were drastically incorrect. The cities that were predicted to be the most vulnerable ended up being the least, and vice versa, as you can see like in the maps as far as Richmond, Virginia, and Austin, Texas. I ranked that initially as the most vulnerable and Richmond, Virginia as the least, just based on my prior knowledge of the size of the cities and the populations and just where they stood on the geographic areas of the map, but I was totally wrong. Can you switch to the next slides, please? This slide is just a breakdown of all my results, so you will be able to actually see the numbers. Can you go to the next one? I'm almost done.
Oh, you're fine.
Okay. So here are my post-research rankings. So from most to the least vulnerable. So number 1, I had coming in at Richmond, Virginia, just comparison to what they ranked in all the variables and how they had a higher risk in comparison to the other 2 cities, Austin, Texas, and Columbus, Ohio, in regards to coronavirus. Number 2, I had coming in at Nashville, Tennessee. Although they were kind of ranking at the midpoint in the beginning, things like asthma which is a respiratory condition. And the coronavirus is attacking the respiratory system, which I believe is a strong factor that makes them more vulnerable than any other population. And then number 3, I have coming in at Columbus, Ohio, and number 4 as Austin, Texas. Next slide, please. Okay, so I just have some basic solutions for mitigation strategies. So I have strictly enforcing social distancing procedures. So, wear the mask, 6 feet, gloves, just necessary safety precaution measures, as well as better testing procedures for the identifications of those who have the virus, just because the how extensive the test is, a lot of people don't want to bother with getting it. So, and a lot of times the symptoms are asymptomatic, so they could be walking around with it and they don't even know. As well as, I also included finding ways to try to implement individuals back into society, because if you're so secluded for a long period of time and you're not going out or anything, it could weaken your immune system. So as soon as you step back outside, it can make you more prone to catching the virus. The next slide. And that's my works cited, and that's it.
Okay, thank you very much. Let me go back to this slide. This slide is, we went past that one very quickly. So you wound up with, it was Richmond being the most vulnerable, correct?
Yes.
Okay, yeah, so let's see. Population density, 3rd, but then percent over 65, African American, poverty, asthma is close. SOVI, wow. I'm curious as to why Nashville has such a high SOVI. I cannot, and that's interesting. And then Nashville, and Richmond in terms of homeless population, which is an interesting variable. Well, I'm surprised that Nashville has the highest homeless population, although I shouldn't be surprised. As I mentioned before, this class, when we met as a live class, one of the things that we did was volunteer in the homeless count every year. And so those numbers are about correct for what we used to find. And the reason that we used to volunteer was that as Nashville's downtown gentrified, homeless people kept getting pushed out farther and farther from downtown. But all the homeless services are downtown: the men's shelter, the women's shelter, the Campus for Human Development, Room in the Inn, the homeless clinic are all downtown. And so as homeless people get pushed further and further out, the Homelessness Commission was trying to get Metro Council persons to set up homeless services in their districts. But the last thing that any council person would want to admit is that they have homeless people in their district. So they would turn a blind eye to it. So we went out with GPS receivers with the volunteers, because in previous years, the qualitative data collected on homeless persons was not location based. So a volunteer might say, oh, we found 3 homeless people behind Reverend Jones's church. Now, if you didn't know where Reverend Jones's church was, you didn't know where those homeless people were. They could be anywhere in Nashville. But when we pinpointed the location using GPS, we showed that there were persistent pockets of homelessness outside of, I guess, what we would call zone 1, 2, or 3. Homeless people out in Madison, homeless people on West End, and so on and so forth. Homeless people out in Antioch. And so we helped to change that, change the city's allocation of resources for homeless people from focusing only on downtown. So yeah, that's an interesting variable that Carruthers included, because sometimes we just forget about people who are homeless, which is interesting, which brings me to the next point. The point that I was going to make earlier but forgot about is that, and it brings us back to this whole issue of Malthus and this whole Malthusian perspective on this, issue of COVID-19 and how we're looking at it as putting Malthus's theory on trial, so to speak. So homeless people might be seen as a less desirable or less strong sector of the population. Maybe these people are quote unquote weak. At least that's the common notion when people see homeless people. People think, oh, I could never become homeless. But a lot of homeless families are there because the mothers were victims of spousal abuse or domestic violence. And the women had to make a decision. Either I stay with this man and have him kill me and my children, and you know that happens if you watch the news. These guys will do that. Or I can leave him and all my money and my car and go down here to the women's shelter. And that can happen to any woman, regardless of her level of education. You think you're too smart to end up with an abusive person. No, you're not. And so there are a lot of people, about 25% of homeless people are veterans who have served this country in the military, and for whatever reason, post-traumatic stress, and a lot of people don't like to call it post-traumatic stress disorder because it stigmatizes. So they say it's just PTS, not PTSD. And so a lot of these military personnel, if they are able to get on their meds, are just fine. But for a variety of reasons, they get off their meds, they end up unable to take care of themselves and wind up on the streets after defending this country. And that's just, that's just, I don't know. I can't even think of the word. So when we look at who COVID-19 is affecting the most, almost zero fatalities for children under the age of 15. We don't really get into a lot of fatalities until we get to people over 40 and 45. And then when it gets to people over 65, which could also be called the quote unquote weak, death rates go up higher. People who are under 65 have some underlying health condition, diabetes, obesity, heart condition, cancer, asthma, which could also be considered weaknesses. So this disease is largely killing people who have compromised immune systems or older. It's, some would say or would interpret as essentially carrying out a social Darwinist, perspective. I mean, if you're into this survival of the fittest mentality, right? And we look at this disease, the stronger people don't even know that they have it. Asymptomatic guy that don't even know it. That's like 80 or 90% of the people who test positive don't even know that they have it, but because their immune system can handle it, right? So when we see all these cities and states opening up, really subconsciously, some people are thinking that we are willing to sacrifice those who we deem to be weak so I can go out here and make some money, get a paycheck, and not starve to death. It's almost like it's the lesser of two. What do we call it? The devil you know versus the devil you don't know. You don't know if you're going to get coronavirus. You don't know that if you get it, whether you're going to die or not. But you do know that if you don't want to work every day and there's no food in your refrigerator, your children are going to be hungry and you might become weak and die of some other disease that way. And it's a really, like I said, it's really challenging the notion of the Malthusian theory from a social Darwinist perspective. We look at, should we open up or not? Who are we protecting? We're protecting those who are weak. Should we do that and sacrifice the prosperity of the masses? Or should we just accept the fact that, hey, some people are going to die. It's just a fact. People die every day. And let's just go about our business. Very interesting times we're in right now. Very interesting times, like really putting the Malthusian theory to the test. And we see both sides of it. You know, we see, people saying, hey, we need to protect those who are weak, and then other people out in the streets marching, and people don't even want to wear a mask. The heck with everybody, I don't know. It's just very interesting. Okay. Who's up? Let me stop my share.
Okay, go to the next slide. Oh, thank you. This is my table of contents. My 4 city rankings would be next. The cities that has the coronavirus risk and unemployment rate that I really want to talk about, and the correct rankings. Next slide. So, as you see, I put the first city, of course, where I live, Atlanta, Georgia. I should have put Los Angeles, California, but as you know, we was the first city to open up, so that was like off the top of the dome to put them first. I pick Atlanta, Georgia because it's the population is not that big, but it is. But as I said earlier, we was the first one to open up, so that was the main reason I put them first. And the virus has been going crazy here since then. Los Angeles, California, I put second because the virus there is not as crazy as Georgia, but now as I look at the population and now as I look at the chart, it's more depth than Atlanta, Georgia is. So yeah, the final rankings are better. I put Houston third because Houston, the coronavirus there and the population is not as bad as Los Angeles or as Georgia. So I put them third. Seattle, I put them last because Seattle population is small. It's not that many people that stay in Seattle, and the virus there, the rate of the virus is really, really low. It's not as bad as the other 3 or is as worse as Los Angeles, California. Seattle actually is pretty good. And it's a small city. It's not as big as Houston or Los Angeles or Atlanta. Next slide. So, as you see on the side right there, I put the population and the coronavirus index. That's wrong. I don't know why. It won't change, but for some reason, it just put that number in there. I don't know why. I don't know what happened to mine. But as you see, I put it down here. As of April, Atlanta had the highest percentage, which was 91.5% of a risk factor. So that's basically like saying sir?
Yeah. Just stop you just for a second. And this isn't just for Jerry, but a lot of presenters have added units to the COVID risk indexes. An index doesn't have units. It's just a number. So it's not a percentage. It's not anything. It's actually a normalized value that might include percentages of Black people, of poverty, of X, Y.
Oh, okay.
But it's unitless.
Okay.
Yes, when you say 91.5%, it's like, whoa, really?
Yeah, that's what I thought. That's what I thought it meant.
No, yeah, that is a high index.
Right.
But it's just like saying it's almost like saying if you score in the highest quantity on a test.
Okay.
Anyway, keep going. I'm sorry. I just need to.
No, you fine. You fine.
Okay.
Yeah. So it's 91.5%, which was in April, but now as of May, I just looked at the chart. It says on May 5th is now 28.67%, which is better than before, but still kind of bad. As you see, it's a 51.85% percentage of Black people, and most of the virus has been attacked in the Black community. And as you know, Atlanta is really, really huge of a black population. As you see, it says 51.85%. So that being said, I put Atlanta first because the percentage of black people staying in Atlanta and the percentage of black people that's catching the coronavirus made me pick Atlanta first. So that's the reason why I put them first. Next slide, please. As you see, Los Angeles, California, it's, I don't know how to read that number because it said 913.29. That's why, and the other one said 92.
Which number are we?
Oh, that's the COVID-19 are higher than Atlanta is the percentage is 913.29, and I got that from that same, the one that you had post.
Yeah, it's not a percentage. It's just the same. It's just a an index. But that 913, I'd have to go. That I don't know. Yeah, keep going. That's again.
Yeah,
In any case, an index is relative, so it really doesn't matter as long as you have the decimal in the right place. Which I'm wondering if that's the case. But as long it's a relative value, so it really doesn't matter.
Okay.
As long as the decimal's in the right place for all of your data, then you're okay. But if it's not in the right place, then like if that should be 91.3 instead of 113, then that can be problematic.
Okay. Well, I could fix it though. But as you see, it's 91.3. But as you look on the chart right here on the side, the percentage of black people is 9.80%. But as you see, population over 65 is 838 and 151 people, which is really crazy because I never knew that Los Angeles, California had that many people over 65. That's a lot of old people staying there. But the African American community are very slim in catching it because it's only 9.8% of black people there. So that's what made me pick the city second because it's slim for people to catch the virus. I mean, black people to catch the virus, but at the same time, I should have put Los Angeles, California first because the population rate is really, really higher than any other cities I've chosen. I had picked, was picked for me. Next slide, please. Houston, Texas is third. You see the population is 2 million people. The percentage of black people is 22.50%, which is a reason I should have put them second, but at the same time, population is not as much as Los Angeles, California, so that's why I picked them third. The African community is having a huge impact in Houston because a lot of people are unemployed, which is why I picked that as one of the topics to talk about because unemployment rate is really going out through the roof and it's affecting a lot of people. So that's why I chose one of them to talk about from the chart. Next slide. Seattle, Washington is last because you see it's only 774 people staying there. It's only 6.99% of black people. The risk of coronavirus is very low, 0.71%. So that's why I put them last. It's very, very low chance of catching it. Next slide, please. So now I want to get into the unemployment rate. Why I chose the unemployment rate is because it comes in effect in so many ways. One way is unemployment rate can affect people. I say, if you get, God forbid, you get the virus, and you don't have money to go to the hospital to take get the medicine to be taken care of. Two, you might have kids, you probably can't take care of them, and they could get the virus. So I picked unemployment because it goes in effect in so many ways. So one way I looked at it is in Atlanta, Georgia, it was right now the percentage is 4.70. It was 3.9, which is a kind of a big jump. I see that the virus has been affecting a lot of people because they lost their job, including me. A lot of African Americans has been affected because of the virus, which are a lot of factory jobs, a lot of small business. So that's what made me pick it because the virus has ruined people's pockets and pretty much their lives too. Next slide, please. Los Angeles, California, unemployment rate jumped tremendously high. It was 4.22% last year. Now it's 6.40% now, which is 2% is up. A whole 2% is up. So, and living in California is not cheap. So I can imagine how people are, dealing with the coronavirus and unemployment rate. And unemployment. So it's probably more homeless people than ever before. But it is a lot of millionaires and billionaires staying there. But at the same time, you have to think about the middle class that is staying there. So, next slide, please. Houston, Texas, the unemployment rate was 3.70, but now it's 5.0%, which is a huge jump also. As I was reading the article, it's really affecting the Black community there. Like I said before, it was 20.75%, and most African Americans work at low income jobs, like middle class jobs, as I'm saying, like factories and things. So as the coronavirus affect them, the employment went straight up to the roof. Next slide, please. And last but not least, Seattle, Washington, unemployment rate was at 2.7. Now it is 5.70, which is really, really, really bad. It's worse than the other three because it went up by 3 percentages. And that is not good at all. Because of the coronavirus, it really made people lose a lot of jobs, money, possibly homes too, like I said, for San Francisco. And I really was surprised about Seattle having a bigger unemployment rate because Seattle virus, the chances of getting the virus is really slim there, really, really slim. Next slide, please. And these are the correct rankings on the left side. So now I put Los Angeles first because of the population and because they literally just went back into lockdown. So, looking at that and looking at the population and the chances of catching the virus is high. So that's what made me pick them first. Now I put Houston second because of the population. It's 2 million, and the chances of getting the coronavirus is middle, kind of high, kind of not. Atlanta, Georgia, I picked them third because the population, of course, is only 400,000 people here. Houston has 2 million, Los Angeles has 10 million, and then Seattle, Washington has 800. And I picked them last because I see Seattle as last because of the coronavirus. It's slim, so people don't have a high chance of catching it as of Atlanta, Georgia, or Houston, or Los Angeles, California. And the next slide, please. And then also my worst side of the page. I forgot the page to put for preventing risk, prevent from not prevent, but ideals of keeping people safe. I have to put that in there.
Okay, thank you very much. I do have a couple of questions, definitely. First of all, so in terms of your initial rankings, did you kind of just go off of purely the data or specific data associated with the cities in the without looking at anything such as news or?
Yeah, that's what I went for the news, and I went from the GSI. So it was like I didn't know what to do because it was so much. I was reading the articles and they were saying Atlanta was #1, and then as I look, I was like, well, the population. So I just stuck with Atlanta because we were the first one to open up. So it was like that's a given away thing to me because that's more chances of people catching the virus than Los Angeles, California, because they on lockdown. But then when I look at things, the population is tremendously a big gap between Atlanta and Los Angeles. So it made me pick California first because of the population.
Yeah, understood. But I mean, anybody can answer this question. Why was anybody else surprised to see Seattle, Washington so low? Given what we know about the spread of this virus? Was anybody else surprised? And why were you surprised to see Seattle so low?
I think I was surprised too because that is where from the news, that's where it actually began spreading the US. So I think like I was surprised to see it last.
Yeah, I mean, yeah, that was the first hot spot. I mean, that was the first outbreak.
I did not know that.
Yeah, that was the first outbreak. That was where, for a while, it was only in Seattle, or at least in the just outside of Seattle, and primarily in a senior citizens or a nursing home. And then, of course, it quote unquote spread everywhere else, which again was seen to be somewhat erroneous because it was found that New York's coronavirus cases came from Europe, not from Asia, where they definitely know that that's where Seattle's first case came from. And at first, it was believed that all cases came from China.
China, yeah.
But Seattle was our first hotspot. I don't know if that's still the case. Now, maybe you're looking at it now because Seattle did have a head start in terms of social distancing because they were.
So that's why it's probably low now.
So, okay, and then the second thing I wanted to ask you. So you seem to emphasize unemployment as your main weighted variable.
Yes, sir.
And you were saying that 5% unemployment is bad and so on and so forth. But anytime that we look at data, or especially any data in the context of a larger data set, we have to look at it in context, not just as it exists at present. Okay. So for example, 5% unemployment is bad if the unemployment rate was 3% a little while ago. But in relative terms, we go back 10 years ago to the 2008, 2009 recession.
That's really bad.
Unemployment rates were 10%, 12%, and that's regular unemployment rate. And we know that on average, the African American unemployment rate is consistently double the main unemployment rate. So even taking the Black unemployment rate in the context, I'm saying now because I'm still wondering about those numbers because I've heard much higher numbers in terms of unemployment right now. I mean, we've got, I can't remember how many, maybe 30, 40 million unemployment claims. It was over 30 million unemployment claims. And those are just the people who filed from unemployment, right? There's other people who lost their jobs that just didn't even do that, right?
I just did it by cities though, so that's why it's probably low.
Yeah, so exactly. So you have to look at, so anytime, so for example, I'm trying to think of an example from, so a good example are those asthma rates. So even though we might look at asthma rates in each city, not for this assignment, because I only wanted you to stick to, the relative, how these cities perform relative to one another. But if you were looking at this on a greater scale, you would also say, okay, Nashville has 10% of its population is asthmatic. How does that relative to the entire country? How is that relative to the state of Tennessee? So then, if you only look at Nashville and that variable itself in Nashville, we don't really know if that number is relatively low or high. If we don't look at it in the context of the rest of the country, or what's done sometimes is we have cities that are in what we call peer groups. We might look at a variable for Nashville as it compares to Austin, Texas. So Austin, Texas is seen as a peer city to Nashville. It's a capital city. It's about the same size. The big difference with Austin, Texas, of course, is that they have the University of Texas at Austin, but then Nashville has several academic institutions also, which is why we have the nickname the Athens of the South.
Oh, okay.
The peer city to Nashville is Charlotte, North Carolina. I mean, that's so if you look at cities that are similar, we should have similar magnitudes of various variables, poverty, so on and so forth. So if we see a spike in any of those, so if let's say Nashville's unemployment rate is 5%, but Charlotte's unemployment rate is 10%, Austin's is 10%, and another peer city sometimes is Louisville, Kentucky, and Columbus, Ohio. All those cities have 10% unemployment rates, and their peer cities in Nashville. Then in that context, 5% is good. Like, whoa, you know, we're very similar to these other cities, but what's Nashville doing right? So you would literally have people or teams from those peer cities, this happens all the time, fly to Nashville and meet with our neighbor, our mayor neighbors, meet with our mayor and city council to see, okay, you know, we're your peer cities. Why do you have a 5% unemployment rate and we have 10%?
Right.
And so that happens all the time. So you always have to look at these numbers in the context. That's all I wanted to say about
Okay.
that. Yeah, I think that's all. Yeah, so okay. And I'm gonna stop my share. Okay, I think
Of course, our presentation is on the vulnerability to COVID-19. Granted, I was looking at mainly the statistical data. And granted, I'm thinking also if this happens again, who is also at higher risk. So we're looking at COVID-19, but I'm also thinking for future, if you have another health, basically epidemic, what city is at the most risk? But COVID-19, their effects, it's basically an upper respiratory infection, and there is a higher percentage of Black people who have asthma, so that doesn't help that situation. I work with a lot of African American people, and some of them have asthma, and they are staying far away from everybody as possible. And then, of course, people in poverty, they don't really have any access to any preventative health care. So if they get sick, they're kind of stuck. So they have no really ways of getting medication or getting help in this situation. So poverty, of course, if you're the most at risk. And I mentioned in my paper that there is this almost like a stigma that African Americans are considered like more poor, which in my paper I kind of disprove that they're correlated, but they're not necessarily like one doesn't necessarily mean the other. So if you're African American doesn't necessarily mean you're poor and vice versa. And of course, people with healthier diet are usually in better health and less susceptible. Granted, that depends on where you live. Of course, I live 30 minutes outside of Nashville, so I'm relatively far out in the country. And so my cities were Honolulu, Hawaii, Detroit, Michigan, Pittsburgh, Pennsylvania, and Miami, Florida, which are very, very much spread out. The only two closest ones are Detroit and Pittsburgh. But my analysis was a comparison of variables which can increase a city's vulnerability to health concerns. So not just COVID-19, I'm thinking of the broader picture that for the future at this point. So here's my cities. Honolulu, Hawaii is way far away from the other one, so it was really hard to get these on a map. But yeah, Pittsburgh and Detroit are the closest cities. The other ones are all spread out. So this is what I ranked them. This is only based on my small amount of information and the population. Detroit, Michigan has a pretty large population. I'm thinking the most I know about Detroit is there is a lot of people in poverty and the city is slowly falling apart. And I'm thinking they're at the most risk of this, probably a high poverty rate as well coming into this without any prior knowledge of this. And then I was thinking Miami, Florida, because you hear that Miami's seems to be a pretty large city in comparison. Now I knew nothing of Pittsburgh or Honolulu, but I ranked them based on originally population, being like a larger population, more at risk. Like Nashville has a significantly higher rate than like Dixon, Tennessee, or something like that. And population has a huge effect on that. So I put these two maps next to each other, population density and just overall population. So you can clearly see that Detroit has a huge population in comparison, Miami following. Then you have Pittsburgh, and then you have, actually no, Honolulu, then Pittsburgh. And then population density, I was surprised Miami has a huge population density. I was thinking Detroit or Pittsburgh would have a larger one. Honolulu, Hawaii is more, I guess, rural, I was thinking. So that makes sense. And then, of course, I included a chart. I like to do maps and then charts. So definitely the least at risk was Honolulu, Hawaii. They have a decent population. Their population density is extremely small, which definitely has a major factor for these large cities, because Miami clearly has a huge population density, which I was thinking, okay, huge population, more at risk. And then, of course, Detroit has the largest of overall. I didn't expect Detroit to be this high, but Detroit has a significantly higher population than both. It has 1.5 times the population of Miami and double the population, basically, of Honolulu and Pittsburgh. So I'm thinking, I'm just comparing ones that are similar. So definitely off of population density and population, I'm thinking Detroit is still the most at risk, and maybe Miami being the second due to population and population density. So then I grabbed Black population and poverty. Granted, these are not necessarily, one does not mean the other. So I was really curious to look at the comparison of those. So clearly, Detroit has a lot higher Black population, and that didn't really surprise me. I'm thinking large city. I knew more about Detroit than most other cities. The other ones I was not very familiar with. And the same thing for poverty. I was expecting Detroit to have a higher poverty. Now, I didn't expect Miami to be such a high rate of poverty. So basically, based on my maps, I was thinking Detroit, and then either Miami or Pittsburgh were the next vulnerable if you just base it on these. And of course, Detroit's numbers came out. And I also included asthma as part of this, because there's a large, Black people usually are more susceptible to having asthma, which is a large health concern, of course. But of course, Detroit does have the larger population. So even though there's only, I think it's 1.15 difference between the percentages, Detroit and Miami have a significantly higher population. So even though Miami's is smaller than Pittsburgh's and percentage-wise, they're going to be more people have asthma. And also, Detroit had a significantly higher Black population and poverty population. So I looked at that in the perspective of looking at, like, Black people are not necessarily poor because you only have a 36% poverty rate, and then 78% are African American. So clearly half of those people are not Black. But definitely Honolulu seemed the least likely. They have a really low Black population, really low poverty. Asthma, I was surprised that asthma was still relatively close to Pittsburgh's. I was thinking it would be a lot less initially when I was looking at the data. And then, of course, I moved on to income, because income definitely has a huge variable on what you can access, whether it's food, healthcare. So I wanted to strictly look at those. So your average household income is significantly lower in Detroit. Same for your average individual income. Detroit seems the lowest out of all of these. I was thinking, okay, you have less money, you have less ability to get health care because you don't have very much money, still the most susceptible. And then Miami came in second with the least amount of income. And of course, Pittsburgh and then Honolulu. So both of those maps, household and individual, were basically mirroring each other if I ranked them. And then when you actually look at the data, it's very interesting that Honolulu has a significantly higher household income. The average income is higher than the rest, but it's more than double. So I was like, okay, that makes sense. And I also included rents just to get an idea of, hey, if you have this is how much average income, this is how much your average rent is, what can you afford? But Detroit has the lowest of individual and household income out of those. So I was like, okay, that's still I'm thinking Detroit is the most susceptible. And I know at the bottom, income is very low because it's hard to live on that. That's like what a college student makes. Actually, it's less because I'm a college student. I make more than the average person individual in Detroit. So I'm thinking, okay, if I can't buy healthcare and all of that by myself, then it would be really hard for them as well. And of course, Miami came in second with which they're only 4,000 less individual per year, but still significantly lower numbers in comparison. Pittsburgh and Miami kind of alternate between which one is higher or lower on the list. And of course, I looked at 3 different databases. I looked at the Social Vulnerability Index, the COVID-19 Risk Index, and the JV and Microsoft COVID Index, which give you different ideas and different rankings based on the information. So social vulnerability, I realized I did these a little bit backwards, but the smallest is the most vulnerable. So clearly Detroit has the smallest dot on the map, so it's the most vulnerable in terms of social vulnerability, whilst Miami is the least vulnerable in this situation. And then I moved on to the COVID-19 Risk Index, and also Detroit's was the smallest circle. Pittsburgh was relatively close in terms, and of course Hawaii's was the largest. Miami's is only a little bit smaller than Honolulu's. So definitely Detroit is still the most vulnerable city. And I moved on to the Microsoft JVN one, and I ended up actually doing this one correctly. Most vulnerable was the largest dot. And it was surprisingly, I felt like this was less accurate because I feel like Miami and Pittsburgh, all the other information is pointing towards Detroit as being the most vulnerable, and they're pointing towards Miami and Pittsburgh pretty much being neck and neck. Then Hawaii, then Detroit is the lowest. So I was very surprised with those numbers. I included a chart with a comparison of all 3 of them, mainly due to I was like, wait a second, why are these strange? So Detroit, I highlighted in this weird teal color that, of course, Detroit seems the most vulnerable, but like the Microsoft one, as I mentioned, seems the least accurate. So I was very surprised they gave a very low rating for COVID-19. And it gave Miami an extremely high one. I could see that because they're the second largest population. But overall, Detroit still seems to come out on top of being the most vulnerable, and then it seems like Miami after that, and then Pittsburgh, and then Honolulu. So which city based on the data is the most vulnerable? It seems that Detroit pretty much comes in most vulnerable in every single category. They have the lowest income. They have the highest population. They don't have the highest population density, but they do have a relatively high one. And of course, you have the other factors as well. So I was surprised that I was just guessing off of population, and the rankings from all the data ended up being the same as my hypothesis, which I was very surprised about. But granted, I didn't know anything about most of the cities other than Detroit, Miami having larger populations. But yeah, so ranking Detroit, then Miami, then Pittsburgh, and then Honolulu. And the reasons why these were ranked how they were. And I ended up changing. I was thinking Pittsburgh was higher than Miami. They were very close, but I ended up changing it to Miami as second. But Detroit has a very high population. A third of their population is Black. You have very low income, and more than 1/3 are in poverty. So that's a pretty huge chunk. I think it's 36% are in poverty, which does not help when you can't have access to healthcare or healthy foods or anything that can possibly prevent you from getting sick. And then, of course, Miami, they have the second largest population. They have a humongous population density, more than twice of Detroit's. And then, of course, about a fourth of the people, so about 20%, or no, it's 25% are in poverty. they have a moderate income. I wasn't thinking of income as much in there. They have a higher rate of asthma. So does Detroit. Detroit and Miami have the higher asthma rates. And then, of course, Pittsburgh, it has a smaller population than Miami. So like 672,000 versus 301,000. So it has basically less than half. And a quarter of the population is Black, and then a fifth of the people are in poverty. Granted, they have seems decent income, and their population density is significantly higher than Detroit's, even though Detroit is the most vulnerable. Sorry, I meant to actually put that under Miami. Yeah, Miami's has the higher population density. Pittsburgh has the next following, but it's close to Detroit's. It is higher, but I think it's 54,000 people per square mile versus Detroit's, which is 51,000 per square mile. So it has a higher one than Detroit. Miami has 11,000, which is double. And then Honolulu, of course, is the second smallest population, has about 301,000 people. It has a very small population density of about 1,600 range. So basically less than a third of Pittsburgh or Miami, which I guess that makes sense. They're more spread out. It's an island. There's a lot of mountains and stuff in the area. So that made sense to me. And then, of course, they have very low Black population, very low poverty. Poverty was only 7.7%, which was significantly different from Detroit's, which was 36, and the other ones came in around in the 20s. And they had the highest income. So what I would recommend, this is not just COVID-19. Of course, you should keep your distance and stuff, but I'm thinking of for future health concerns. So, of course, you need to increase opportunities for better paying jobs, which allow better access to healthcare and food, and, of course, increase access to unemployment agencies. So those people that are in poverty or homeless, which I include them in basically the poverty. I'm thinking homeless people are basically in poverty. So if you have more access to that, those people that have no jobs, that are selling papers on the street, have a significantly better chance of getting an actual job that will help them get out of their situation, and maybe have them have healthcare that comes along with their job, because most large businesses have to include healthcare. And of course, increase the access to healthcare for the people in poverty beyond Obamacare. So Obamacare did increase a significant amount of people that had insurance, but it seems like we need to go farther in terms of people, because some people can't even afford Obamacare. They don't have much money at all. And then, of course, attempt to spread out this population density of cities. So less buildings, less housing that's all compacted together. Just like the urban heat island, the more you're spread out, the less heat that accumulates there. So the same thing with, you don't want your population, the higher the population density and population, the more at risk you potentially could be for not just COVID-19, but future health concerns, whether it's another flu. We've had plenty of flus. And then, of course, provide better access to grocery stores with healthier food options, which will also is a more preventative thing. Like, I live 30 minutes outside of Nashville. There's like a Dollar General and a Lawrence's Foods. And there is some access to healthy foods, but it's not very small. And if I'm thinking from my perspective, for other people, then they're not going to have a huge access. They're going to have to drive closer to Nashville to get those foods. So I did forget a works cited page, but overall, I was just basically looking at all the data and cross-checking them, and then ranked them based on that. The maps for the social vulnerability and the COVID-19 risk index, I think one was based out of 6, but I based it out of 5 based on, it was ranked from highest to lowest. And then, of course, I did medium, and then medium high, medium low. So I ranked all of them based on what they rated them as. But overall, Detroit was definitely the most at risk, has the largest population, clearly needs more preventative policies which help reduce this in the future, not just for COVID-19. Most cities like Nashville are staying closed, because I work in Nashville. Most of downtown is still closed, I think until like July is what they're predicting. But we have to keep our distance, basically, and follow whatever guidelines the government puts forth, because you have a lot of people that are upset about that. And there's not really a reason to be like, I can understand you want to go outside and stuff, you want to go places, but it's for your own health. Would you rather be sick or would you rather have freedom? Like, that would be the comparison there. So there's my presentation on the vulnerability of Detroit, Miami, Pittsburgh, and Honolulu for COVID-19, just looking at statistical data to see which is the most susceptible to COVID-19 and future health problems.
Okay, thank you very much, Evan. I just have I guess a comment and a couple of questions. So the one comment I have is the that table you had where you compared. You go back to that table where you compared the indexes.
The indexes. Okay.
Yeah, that one. Yeah. So this is really interesting because this table clearly shows you exactly what I mentioned before. Now, if indexes, which are in a sense a form of modeling, if indexes were equally accurate, then you would have the same outcomes for the indexes. But as you can see, there's not a whole lot of agreement amongst these three indexes. So speaking of that, I'm building upon that point, and I have a couple of questions for Evan. The first one is, I'm actually going to want you to go back and look again at your top two. Could you go back to your rankings, your final rankings? I think it was, so Detroit, Miami, I think you had a slide that had a little bit of that last slide 19. Yeah, that one. Okay. Yeah, so we've got Detroit and Miami. I would look at that again, just to, not that there's a right or wrong, but just to really flesh it out, because there's a couple of variables, one of which is somewhat comes from your background. So you're a political science major, right?
History major, political science minor.
History, poli-sci. So from a political standpoint, did Michigan and Florida have different approaches to their response to COVID in terms of policy, social distancing, so on and so forth? Did they have the same, or were they somewhat different in terms of their response?
Well, no cities are the same. Usually the higher population, like New York or something like that, they shut everything down, keep people inside. So I thought that Miami and Detroit would do something similar.
But I'm looking at it on
react in a different way.
But a lot of the mandates came from the state level of government, right? So if you look at Michigan versus Florida, was there a difference? Well, you might want to look into that, because I'll just kind of give you a little spoiler alert. Remember Florida during spring break? Did Florida shut its beaches down during spring break, which was in March? Did they shut down their beaches during spring break?
No.
No, they did not. That was very controversial. Did not shut down their beaches during spring break. All these, college students were partying hardy, and this was in March. I mean, in Florida's governor, Republican governor, very close to Trump, was really reluctant to shut down. What happened in Michigan? If you look at Michigan, Michigan had some of the most strict, I don't know if they're still in place, they had a very Democratic governor, strict, almost, in Michigan, a person couldn't even go outside the house to go to another person's house, right? So if you wanted to go to your cousin's house, you couldn't do that. Now, don't ask me how they enforced that. So you had two very different responses in terms of social distancing mandates in Florida versus Michigan, very different. So which we have to take into account in terms of assessing vulnerability, even though it's more of a less quantitative, more qualitative. Very difficult to put that in a table, but you can look at it as a variable. Related to that, if we look at Miami, well, let me go back to Detroit. Let's look at population density. So even though Detroit has a higher population, I believe, than Miami, the population density is much higher than Miami than it is in Detroit. So what happened to Detroit? Detroit, after in the 1950s, had 2 million people living in that city. It was the height of the second industrial revolution for the United States. Specifically, I mentioned before that at one time, 99% of cars made in the world were made in Michigan, not just in the United States, in Michigan. So Detroit was was probably the epicenter of the manufacturing boom. 2 million people lived in that city about 50 years ago. That city has depopulated. So in terms of land area, Detroit is a very large area, but it's a completely depopulated. Detroit is so depopulated that people are engaged in what's called agri-hood farming in Detroit, to the point that so much food. So what people have done is taken all that vacant land that has been left behind after almost 1.5 million people have left Detroit. And there's so much vacant land that's literally been turned into expanses of farmland that produce food at a level that it can sustain the entire population of the city. I mean, that's what's happening in Detroit. It's the population of Detroit has a very dispersed population, which also speaks to perhaps lower risk in spite of the demographic factors. Speaking of demographics, Evan, there's a demographic variable that we left out of our given data set, but is there one demographic variable about Miami that specifically we might want to consider?
In terms of most of the, like, are you asking like one I didn't include or one I did include and didn't?
Well, it wasn't a demographic that was included in the original data set, but you could have included it as one of your elective variables. But it would have specifically had a significant impact on the perspective you have on Miami's vulnerability.
I know in the presentation I didn't put population over 65 into that.
Oh, that would be another. I forgot about. It's Florida. It's Florida. That's another thing. It's good. Yeah, Florida is a retirement hub. I mean, yeah, if you look at some of those communities in Florida, significant numbers of people over age 65. But also, what is Miami's nickname? The capital of what? Yeah, Miami's nickname is the capital of Latin America, right? So if you've ever been to Miami, you better polish up on your Spanish. Because there are some places in Miami where people not only do they not speak English, if you speak English to them, they'll look at you like, do you know where you are? So yeah, very substantial Latino, Hispanic population in Miami from all over Latin America. Dominican Republic, Puerto Rico, El Salvador, pick a country, Brazil, pick a country. They're in Miami. And finally, and you might want to look at some of these other maps. What is it that's unique about Miami, especially versus Detroit? Well, let's look at it in terms of Detroit. What is it unique about Miami in terms of, I'm trying to, it's too easy a question. What is a big difference about Miami with regard to, say, population movement?
Well, Florida overall, there's a lot of people moving to Florida. I'm assuming Miami is no exception to that.
Yeah, Miami is a tourist magnet. People come to Miami from all over the world, which should significantly, might give you a second take on vulnerability there. As a matter of fact, when we look some of those maps, I mean, if you go online, you'll find these maps of where they've traced movements based upon mobile devices. There are lots of these maps. So they're looking at how effective were these lockdown orders. And some of those maps showed that a lot of people, well, when people left New York, a lot of people left New York, the New York area during this time. Guess where they went?
Florida.
Yeah, in Miami. Miami, the snowbirds, there were other people that just, a lot of people in New York have second homes in Miami. I know some of them. And a lot of them left, went down to Miami. And of course, we know that New York is the hot spot of all hot spots, right? As a matter of fact, there was a period of time when, I don't know whether this was a mandate or if it was suggested or if it's actually happened, but there was discussion about if people came to Florida or out of New York, they had to go into 14-day quarantine. Didn't matter. I don't know whether they actually put that in place. So I just want you to kind of look at those variables with your first two cities. And I don't know. I mean, I don't know. But like I said, this is your ranking. I'm not going to be like, you're not going to base your grade upon it. But it would strengthen your argument if you showed that even with the increased movement to Miami, spring break, people don't go to Detroit for spring break. It's spring break in South Florida, elderly population, lower population density. But you could also bounce it against some of the tables that actually show the cases, hospitalizations, and deaths in Miami versus Detroit. That would be the proof. That would be the proof. If you notice that Miami has higher deaths, higher hospitalizations, and higher numbers of cases, even though cases are really dependent upon testing. So I would say deaths and hospitalizations, those are the two critical variables. And you can find those. I would look at that before I made my final conclusion. Or it might be the other way around. I mean, Detroit might have more deaths and hospitalizations than Miami relative to the population. I don't know, but just some things to look into, but otherwise, really, really good analysis.
I just took black politics, and the black population is most susceptible to the virus. So I took that into a huge factor into Detroit being the top, because Detroit has a 78% population of black people. And when I wrote the paper on that, the highest, huge percentages from Michigan were blacks that were dying from COVID-19 and stuff like that. So the reason I ranked Detroit higher was because of its black population and, of course, poverty being more susceptible. And, of course, asthma, mainly just the asthma poverty of black population being the largest factor. Because Miami doesn't have that high of a black population. Now, of course, if you included minority population, it would probably be a little bit closer in terms of that. But I was mainly looking at the overall things of you have black, the percent of black people, poverty, low income, population density, and just cross-checking all of those. Detroit just ended up on top due to what we know about the virus and the people dying of it, because blacks are the largest percentage of people that are dying from this.
Yeah, and that brings in another issue in terms of demographics is, okay, a Latino can be of any race. So like the Dominican or someone who might be Panamanian is probably Panama. There are a lot of Brazil, 80% of people from Brazil are of African descent. As a matter of fact, 95% of the Africans who were imported from Africa to the Western world went to Latin America. Only about maybe, I'm probably underestimating, I'd say maybe 1% of that population was brought to British North America. So anyway, but I mean, I guess this emphasizes how difficult it is to assess risk given so many variables that we have to consider. And really, who knows? Who knows? I mean, we could have every indicator show us that a place should have a low risk, and then it does. But one thing, and like I said, this is a totally non-expert viewpoint, but if you've noticed, it isn't non-expert because I have read where there is suspicion that there are certain people that have a genetic propensity or genetic vulnerability to COVID-19. So if you notice that in many cases, people go to these family gatherings and it'll kill 3 or 4 or 5 or 6 people within that family, because they share that common genetic makeup. Just as an anecdotal piece, I went to a birthday party years ago, and afterwards, everybody ate the same food at the birthday party. And we found out that there was something in the ice cream. Everybody in my family's bloodline got food poisoning. Me, my mother, my aunt, my great aunt, nobody else got sick. But there was something about us, all of us. Everybody ate the ice cream, but we were only four or five people. Everybody in my family's bloodline got sick. And so we're seeing that somewhat with COVID, that it's killing a mother, a father, and a sister. It's killing an aunt, uncle, brother, but all of these, I guess, characteristics of this virus will be played out in the future as this whole thing unfolds. Okay, so thank you very much. You all did a good job. This has been a pleasure this semester. As someone who teaches 90% freshmen, this has been a completely different experience from the norm. Again, your term papers, and I'm not going to change it. If you want to brush up your PowerPoint, obviously you had to have the PowerPoint ready to present it now, but it is not officially due until 11:30 with the term paper. So if you want to update it, submit a cleaner version, work on your maps or not, it just depends. I was really not grading you on style points of the presentation. I just really wanted to see if you had a clear understanding and really have put a lot of thought into analyzing the data. And everybody really did a good job of that. Nobody just kind of blew this thing off and didn't really focus on it. And again, if you want to have me look at your term papers, I'll be around. I got to get out of here. I've been sitting here for, I guess you all have 3 straight hours. But I got to get out of the house for a few minutes just to maintain my sanity. But when I come back, I will, if you email me your draft papers, I'll take a look at them before you submit them. And then again, like I said, if you've got issues, got to work, something else going on, and you don't think you have an A paper at 11:30 tonight, remember, you do have 10 more hours at 1 point per hour penalty, which probably won't make a difference in your grade. So if you think you can turn in an A paper 9 hours past the deadline, as opposed to turning a B or C paper at the deadline, go ahead, turn in late, give it your best effort, and turn in that A paper. Does anyone have any questions about anything?
I have a question.
Yeah, I got. Oh, go
Oh,
ahead.
okay.
I have a question concerning the extra credits. Like, how does it affect your grade? Like, if you do good.
Oh, yeah. I mean, it's explained in the syllabus. I'm going from memory. I know that those who participated in the collaborative conversation, that 15 points is added to your participation grade for the live discussions, and I believe the other two would be added to your total for your assignments.
Okay.
So,
All right.
so no, no, it won't be like, no, it wouldn't be added to your cumulative total. No, that, because then that one extra credit assignment could push you up a whole letter grade. That, no. But it can significantly add to your assignments. And that's really a stopgap measuring case. You know, I know it's Maymester. Some of you all are working. Who knows what you're doing? And you might miss an assignment. And so the extra credit is just that, to make up for perhaps if you missed an assignment. It happens. Yeah. So you still, so those are due, those assignments, the extra credit assignments are due at 11:30 Friday. So if you want to go on a bus ride tomorrow, I know all of you are overachievers. You want to lock that A in, you know?
Yep.
Go ahead.
That's what we're trying to do.
Just be safe. Be safe. Like I said, you don't have to do it. Or if you want to give that GIS assignment a shot, it's not an all or nothing assignment. It's up to 45 points. So if you can get enough of it done that you can get partial credit for extra credit, fine. You know, it's not as if you don't do the whole thing, zero. It's not an all or nothing. Give it a shot. I know you just learned GIS, but it's like really interesting that somebody actually created a GIS assignment based upon Nashville already. It's not an easy assignment. And if you need help with it, just let me know. I'll try to help you. I just looked at it and said, hey, this would be a neat thing for my students to do, but I haven't even worked through it. But I thought it'd be interesting for you to at least try if you're curious about how GIS might be applied.
I got a quick question.
Yes.
So the legends that you say to put on the paper, I keep doing it wrong, and I'm just trying to figure out what exactly how it's supposed to look like, because I don't know what I.
Yeah, it's just the like I said, I showed you a couple of ways to do it. Where you can just clip the
I try to do it the way that I can't remember who said it, but I tried to, but it didn't work.
yeah,
But
like
I can screenshot it.
I'm not going to grade you on style points. This isn't a cartography class, so I mean, unless you know, I mean, I'm really evaluating how well you interpreted the data and use it to come to a conclusion. I know you're not going to become GIS experts in 3 weeks. It's not going to happen, you know. So don't get caught up in style points on your maps.
Okay.
You know, yeah, I mean, not everybody. I mean, Theodora really knocked it out of the park with her maps. I was like, wow. Have you used GIS before, Theodora?
Nope, this is my first time.
Okay, y'all didn't hear that. Okay, but don't worry about that. You know, no style points for the maps. But it's the data. Really, in GIS, the data, as you probably have figured out by now, means a lot more than how pretty the map is. You can have a really pretty map, nice, pretty legend, beautiful base map, and the map can be totally inaccurate and useless. So don't get caught up. You know, I'm not going to nitpick. You know, don't get caught up in all that.
Yeah, I know it. Okay. I don't know if my legend right though, but I understand.
Yeah, I don't. I mean, you all did a lot better with the GIS than I expected in 3 weeks in a virtual environment where you're pretty much on your own. So, like I said, don't it's. I mean, I know what's on the map. It might not look the way I want it to look, but I know what's on there, and you know what's on there, and so your interpretation of the data is most important. But you know, like I said, you know, if somebody made really, really pretty maps and the symbols are wrong and the data is wrong, then it's wrong. You know, it doesn't matter how pretty it is. But if you could have the ugliest map in the world, but if you decided to try to overlay Black population, well, if you try to overlay population over 65, say with household income, and the map look terrible, but I know what you were trying to do, because those are two interesting variables to look at. Because remember what I said, with age comes wealth. So we can't, but it's different in this case, right? Because that's an interesting question, because even though you have age and wealth sometimes dovetailing together, coronavirus really doesn't care if you're rich, right? I mean, I don't know how old Tom Hanks is, but he's rich and he got sick, right? And say the coronavirus didn't say, oh, that's Tom Hanks. Oh, wait, he's rich. I can't. Now, if you're looking at the holistic viewpoint of vulnerability, Tom Hanks probably has really good health insurance. Whereas there are those elderly people that were in those nursing homes, part of the reason that they're in a nursing home might not necessarily be that they're fragile or whatever. That might be the only place they can afford to be. And so, yeah, their vulnerability is heightened by their socioeconomic status combined with age. But that doesn't mean that a wealthy 91-year-old person can't die from coronavirus. Like Wynton Marsalis's father, who I'm sure was probably quite wealthy, being the patriarch of that musical family. He definitely wasn't poor, but he's gone, you know? So this is just really interesting. And so you all are kind of doing some of the same work that people who are building these indexes and models are doing right now, and just cranking them out. And you see nobody really has one that you can absolutely say, this one is going to be the predictive model for COVID. Right? Who knows? Right? Any other questions? Okay, again, it's been a pleasure. And if you all feel free, I'll be teaching geospatial applications in the fall. Any of you all are welcome to take my class. No freshmen in that class. It's a Geography 3200 upper division. Thank you for. I mean, I love freshmen. I love to all of you all were freshmen once, and it is what it is. But this has been a whole lot different from what I normally go through. You know, right out of high school, and you know, we can hustle, Dr. P. You know, but very well done. So again, I'll probably have everything graded. I'm going to try to have it graded by Saturday. Email me, I might be done. But other than that, it'll be Tuesday, definitely. Next Tuesday, definitely. I'll be done with everything. So enjoy the rest of your day. Thanks for hanging in here with us. And I will be sharing